ARH surgery nurse Kasey Findlay wasn't quite sure but knew something was wrong with her 12-year-old Blue Burmese Gilly. He was lethargic and not eating for 24 hours, so she took him to ARH to find out more. Despite her vast experience as a surgery nurse, Kasey wanted to learn more about Gilly's condition and share it with other pet owners, so she asked oncology specialist Dr. David Lurie to explain.
David, Gilly has lymphoma in his intestinal tract. So what does that mean, and what does it mean for him?
Well, Gilly has a form of lymphoma that's referred to as small cell gastrointestinal lymphoma, and that's a very important distinction to make from the more aggressive type of intestinal disease lymphoma that we see in cats, which is a high-grade or lymphoblastic variant. So Gilly's prognosis is a favourable one with appropriate therapy. Usually it controls clinical signs very well. I would describe it as a minimally invasive type regimen. You know, it's mostly an oral form of medication, 2 different medications by mouth, and they tolerate that very well, minimal side effects, and as mentioned, very favourable prognosis.
And I guess side effects is something that I would guess a lot of owners may be worried about, thinking about giving their dogs or cats chemo. They maybe think about what they've seen with human chemotherapy. So I know I've seen a lot of your guys, particularly the dogs, have their chemo and trot out of here with their tail still wagging. What can I expect, though, with giving these chemo tablets to Gil?
Yeah, I think you raise an important consideration. You know, most of the clients that I see come in with experiences with family members that have gone through chemotherapy and cancer care in general, and it's often with a negative impression of what that entails. Our philosophy treating pets with cancer is quite different. You know, quality of life is the most important goal that we focus on. You know, not at the expense of longevity, but certainly we want to make sure that our treatments are not worse than the disease. You know, that's an adage that we live by. So we're very careful about the dosing and frequency of treatments to ensure we stay ahead of that particular curve. There's also been great advancements now with medications that can alleviate and mitigate a lot of the negative signs we see. So with chemo, we think traditionally of gastrointestinal upsets, vomiting and diarrhea. And both with our strategies in manipulating the regimen as well as the anti-nausea and anti-diarrhea type medications available to us now, we really can avoid a lot of the negative impact of these treatments. It's not to say that they don't experience side effects, but they usually are mild and self-limiting. In most instances, we don't need to intervene. It's rare. I'd say less than 5% of the time where we would need to step in with fluids to rehydrate or an antibiotic or something like that.
Okay. We're having a dental today to make sure we get rid of those teeth that are a little bit average before we start the chemotherapy. Is there any other advice that you can give to me? Like how long will he be on it for?
Yeah, so this particular regimen, as I mentioned, it's an oral regimen of 2 different drugs, and it does tend to be chronically managed. So it's a disease that we don't expect to have an outright cure for, but it becomes a chronic disease like diabetes or something else where you go through chronic management with a favorable quality of life, with appropriate care. So Gilly is going to probably be on these medications lifelong, but initially on a loading dose it'll be more intensive, but as we get further into the regimen and have alleviated his signs and see that he's doing well, we'll start stretching out the interval of his treatments to where he might be taking a pill a couple times a week, for example.
Right, okay, we can do that.
Yeah. We
can do that. All right, well, thank you so much for your time. I'm looking forward to getting him on these tablets and getting him back to his normal self.
Yeah, well, we'll look forward to seeing him in the clinic and taking care of him.
Thank you.